All right. Well, perhaps we can start, Louise, by you introducing yourself and saying a little bit about who you are and your experience and why you're well placed to deliver this training for us, please.
Thanks. Thank you, Marie. Well, I'm Dr. Louise Hayes. I'm a clinical psychologist and I am from Australia. And I have spent the past 20 years doing research and treatment development on working with young people. But I have also spent the past 20 years working clinically with young people, and I also work with women. So I go across young people and women. And I have worked in psychiatric service. I have worked in schools. Many years ago, if you want to go back a long way, many years ago, developed a treatment program that ended up working across the whole state of Victoria in schools and in CAM services. I have done randomised controlled trials, just 2, but that's enough, on treatment development of using ACT with young people. And I've written 4 books on working with young people and adults. And that's about enough for me, I think.
Yeah, I think that more than qualifies you to bring it over. And when you say it like that, it's why we're so excited to have you here in the region with us in September. So thank you very much for that. So in the region, we are becoming more familiar with ACT. And Dr. Robin Walser came last year and trained a number of the professionals here in the model. And of course, she's coming back in June. You were talking about a particular treatment model that has been adapted, that you adapted for use with young people. Can you say a little bit more about that model, please, Louise?
Absolutely. So, and I'm glad that you've got Robin coming. She's amazing, in my opinion. Go and see Robin. She's amazing. And a very dear friend. When you want to work with young people, and young people, by young people, we mean anyone who's under 24 years of age, it's really important to think about the developmental stages of that young person and to think about the way in which they have developed their skills and abilities from birth. So when I first began this work and I fell in love with ACT work, I really wanted to know, how do we do this with young people? And I knew from my being a child and adolescent psychologist that there were some things that were not quite right if you just take the adult work and try to squeeze it into young people, the things that are not quite right. And so along with my co-author, Joseph Cherokee, we began thinking about what do we need to do to make a framework that is developmentally appropriate, that fits growth and development, that fits how people learn to use thoughts, and where are they at in their journey of learning, and how do people learn to use feelings, and where are they at in their developmental journey, and their attachment to others, how is that fitting, and their understanding of themselves, which of course we know grows across that journey of adolescence and early adulthood. And so we had so many questions to answer. And somewhere along the way, we ended up developing a framework that we call DNAV that was really explicitly focused on growth and development. And it was originally developed to work with young people. So that's people like 12 to 24. And then I have been training all across the world in using this framework for the past 10 years. And people would say, I use this with adults. I use this with adults. And I work with adults too. And so we recently just published a book on using it with adults. And so there are multiple ways to think about the work that we do. And my particular focus is, what have you learned in your life so far? And how have you learned this? And how has it influenced how you respond in the world? And then how do I help you use those abilities that you have as a human in ways that help you grow and develop. So whether you have trauma in your background, I like working with people who have trauma in their background. We want to think about what that has taught them and then how to become more flexible as you continue to grow. And
Mhm.
it just has been just an incredible journey.
Yeah. So are there different components of the DNAV model depending on the age group, or do you find that it spans the 12 to 24 age group?
We've actually found that it expands the age group because we're focusing on the abilities that every human has. And so we have colleagues in the UK who have developed a curriculum that and done some randomized controlled trials that is actually from the age of 4 up until 12.
Mhm.
And we have people doing research for 18 to 24-year-olds. And the work that I do, other work that I do is actually with adults. But here we're going to, in Dubai, we're going to focus on young people. And so I think that it's just a way of thinking about growth and development.
Yeah, okay. So just holding the questions that people might have in mind, if they are, say, a psychologist or a school counsellor who works with the little ones, so primary school up to the age of 11, is there something that they will gain from coming to your training?
They will gain some things if they come to the training, but the training will be explicitly focused on 12 to young adult. But there are, because I cover what you have learned, there are some developmental pieces that the only way we can consider that is to begin from when you're born. So let me give you an example so it's not abstract. From the minute you are born, you're born into the world able to use your senses, your eyes, your vocalizations, your ears to take in the world, to connect with other people through eye contact, right? And the nurturing and safety that other people provide influence how you learn and grow through your senses. And so the workshop will focus on 12 plus in terms of the intervention, but the framework helps us think from young through to adult.
Yeah. Okay. And I mean, in many ways, that sort of maps onto other models, doesn't it? Like CBT, for example, you need people to have a way that it matches onto sort of CBT, really, doesn't it? Or other models that you can use the thinking in your work with younger children, but the doing, you need that person to be able to hold the concepts in mind and be able to think quite cognitively, etc. Yes,
Absolutely.
it's a similar thing. Okay. So it is helpful for people who are working with much younger children in terms of conceptualizing and thinking, but it's the older ones, late primary school, high school, that it would be more applicable to.
Yes, absolutely. Absolutely.
All right. And can you say a little bit about the DNAV model? You've talked about how it takes the essence of ACT and it applies it to people's developmental stage. But the acronym, for example, what does that stand for?
Okay. So the acronym stands for the 4 abilities that every human has. And I'm going to use it backwards or in a different order. From the minute we're born able to be noticing with our senses, noticing with our eyes, taking in the world. Very quickly, we learn how to be discovering, which is having agency in the world, learning to do things in the world. And then we learn how to, what we call, give ourselves advice or do advising, which is another word for self-talk. Thinking, telling ourselves how things should be and using our cognitions. And then, so that's the D, N and the A, and the V stands for value and vitality, or valuing and using vitality, which I always think of as what's in your heart and what matters to you. So there's those 4 abilities that everybody has. Everybody, not from the minute they're born, but by the time we see a 3 or a 4-year-old, they already got all 4 abilities. And as we grow, we learn to use them in ways that are either flexible and open and help us grow, or rigid and shut down and small. But those 4 abilities grow inside 2 really important contexts that are essential to understanding this framework. The first is the context of the social world. So attachments, relationships with other people, and there's a reciprocity that happens inside that. So everything we do has this social relationship quality to it. And then the other one is the self, which starts to come on board, 8, 9, but really ramps up when people are 12 and 13, where we begin to develop a relationship of who we are, ourselves. So these 4 abilities rest on a context of the social relationship and your relationship with yourself, your verbal relationship with yourself. So that's the way we do it.
Great, thank you. And in terms of the training itself, there's a 2-day foundational training and then a 2-day advanced. Could you say a little bit about what people can expect to experience and take away from those, please?
Sure. So in the 2-day foundational training, we will cover each of those abilities that we have, and we will cover helping us understand and see them as processes, and think about doing an assessment with young people, seeing the way that they're using the abilities, and experientially using small intervention kernels that you can put in different places of your work to help a person grow and to help a person loosen from rigidity or problems or struggle and know how to manage that. So the first 2 days, it's like your foundation and your basics and understanding how this framework might look, and using it. But I think there's also a really important piece here, that it's a framework that you could come to the training and you don't have to do the whole framework. You can think about the pieces that you could take out and put into your existing work, and that's fine too. There's many pieces that we all draw from, and people could do that too. So lots of experiential work in the first 2 days. Lots of practice, having fun. Learning for young people is through fun. So there's those things too.
Great. That experiential learning is, it's not only does it really bring home the message, but it actually creates a nice bond as well, doesn't it, within the group when you're learning together like that in this kind of work.
It's really good fun. It's really good fun. Like, and that's how we learn. Like, profound and deep too, but good fun as well. So that's what I hope to do in the first 2 days.
Great, thank you.
The second 2 days is your more advanced therapy skills, where we will be practicing and working on treatment of young people at the more pointy end, young people who have trauma in their backgrounds, young people who have current distress at a higher level, and really practicing therapy skills and really practicing how we can help them become more able to live their lives, to let go of the stuff that is challenging them, and to step into places where they also can become stronger and grow. So I do have a particular passion for working with young people who have trauma in their background, such as young people who have grown up in the context of abuse or neglect or harm, as well as external traumas that happen in the environment, the context of trauma. And I think there is a special place for understanding the way that influences development. The way that influences everything that you see in the world, and how, if we can work young enough with people, we might be able to influence that. So that they can grow up becoming more able to have meaningful lives.
Great, thank you. And is that an experiential experience as well in the advanced training?
It is, and the experience will be more practice-based.
Mm.
Role plays and doing therapeutic practices, not super hard so that you need to be an expert, but being instead learners, being able to step in. And we have a lovely framework for helping people develop the skills that's really supportive. So we'll do some therapeutic practices, and we'll do some actions, role plays and things together to help us build our skills so that it's not didactic and so that people are learning through practice.
Great. So if people are relatively new to role play, they need not be anxious. It's a very supportive environment and a great way to learn.
Yeah, we have a fabulous framework that I just love doing it. And it just means that you don't need to be the expert. And it's a framework that allows you to learn and practice without feeling like, oh, I don't know what to do, because that happens to all of us.
Yeah, absolutely. And in my experience of doing similar training where it is very experiential, again, that bond with who you're learning with is really important, and it allows it to feel like a safe space to be engaging in the work properly.
Yeah, absolutely. And because relationships, I think, are the most important pieces of our lives, we bring that into the training as well. So the relationships that we are forming and sharing with each other in the learning environment are important for us to feel safe, to feel like we can take a risk and try something, and to feel supported. So we want to model the very same thing we want people to use out in their lives. And like, there's no me without we. We need to be social and social in our interventions. So that's what we do.
So thinking about the foundational training first, what sort of prior experience or training do people need to be able to attend the foundational training?
I don't, I think as providing people have some level of professional training around being a helper, counsellor, we work with teachers, as well as therapists. And I think that kind of level is pretty broad. We have tried to make it applicable to anybody who works with young people.
Yeah.
And before the training, I will provide people with some short videos so they can do some learning in advance. I have a mini course that I can give to people, and we will give them some reading. So they'll come in with a little bit of a foundation, and then that means we can begin like experiencing together pretty quickly.
Do they need any former ACT training?
No.
Okay.
No.
Lovely. So they can come in. So perhaps a teacher who might not have any experience in mental health specifically, but obviously does have experience of being with young people, could still come to the basic training, the foundational level.
Absolutely.
Fantastic.
Absolutely. And that doesn't mean that it's too simple for therapists.
Sure.
It just means that we're coming in at a level where what we're doing is experiential work with young people and helping them to discover the aspects of themselves that are flexible and open.
Lovely. Thank you. So what sort of requirements are necessary for people to attend the advanced training?
Okay. It's not necessary for people to have done training with me, and it's not necessary for them to have an understanding of DNAV from a workshop. But what I will give them is some watching, probably an hour of video and some reading. And providing they've done that and they have some prior ACT knowledge, they'll be fine to be able to come in and pick it up. So some ACT experience, and they don't need to know the DNAV framework for young people. I will give them prior learning to make sure that just the language is familiar.
Yeah.
That's all. That's really
all right. Thank you. So if they haven't done the foundational training with you with children, they can still come, but the assumption will be that they have invested a bit of time in the resources that you direct them to prior to doing the advanced training.
Yes, and that they know some things about ACT, some of the central tenets that are inside the work that we do. For example, that we care about function and how a behaviour works for a person, that our criteria is to think about ways in which people try to control and avoid and push things away, and that we're trying to help people to open up and think about what works for them. So some of those basic pieces, the people who've done ACT will know immediately what I'm talking about. It's good to have those pieces.
Yeah. And who would the advanced training appeal to?
Um, mental health professionals, psychiatrists, psychologists, social workers, counsellors, anybody who has a helping role in that area.
So would you include perhaps teachers and OT, speech and language, or would that be
Yes, of
foundation?
course. I'm sorry for the OTs and um, OTs and people that are speech and language people. Of course, anybody who works in that area. Teachers, they of course would be welcome to attend, as long as they're able and okay with sitting inside a counselling dyad or
Uh-huh.
triad role plays. As long as they're comfortable with that, that would be fine. They will
Yes.
still learn things about speaking to people and helping young people. Absolutely. And about themselves.
And about themselves. Yeah, I think that bit's key. Um, and for people who are perhaps outside of the mental health profession and outside of mental health training, you perhaps underestimate how much we do learn about ourselves when we attend training like this.
Absolutely. I think it's one of the most important things is what we learn about ourselves, because that
Yeah,
allows us to show up and be present with the people we're trying to help.
absolutely. So would you be able to give an example or two, Louise, do you think, about something that people might encounter within themselves or learn about themselves by doing this training?
Absolutely. Well, I've just come out of doing a 2-day training just like half an hour ago, Marie.
Oh, oh my goodness. Well,
So um, let me give you I'll give you a concrete example. One of the things that we focus on in part of the training is thinking about the way in which we use our own thoughts and feelings and responses in the context of our relationships with other people. So, for example, if you are a parent and you have a young person in your life who is not doing their homework, not wanting to go to school, arguing all the time, we not only learn to work with them, we also learn to work with the responses that we have. So if I've got a young person who's not going to school, if I'm a parent and my young person is not wanting to go to school, arguing all the time, being non-compliant and difficult, I need to think about how that shows up inside me. I need to think about the emotions that I might have and the way that, for example, if they're angry, I might get angry just in return, because we work in sync, you know. And then what do I do with my anger? And if I am in a place where I'm not even aware that I'm angry, then I'll be responding to that outside my awareness. So just the act of not only helping the young person get in contact with their body, their thoughts and their feelings, but helping the person who's working with them do that too, then we get this like mirror image. So we work with parents and adults using the same framework, because every young person has a parent and an adult with them. And so a practical thing might be helping a parent be aware of the way in which they are pulled to guilt and to judgment and to blame and to evaluations around their own parenting ability, giving them some strategies to put that aside so they can respond to their young person just as their young person and the behaviour that they're engaging in,
Mhm.
instead of being pulled outside their awareness. Does that make sense?
It makes a lot of sense. Yeah. And I think that's something a lot of people can relate to. So it's that sense of helping people recognize what's going on for themselves, noticing that and choosing how to respond. And in the context of strategies that you're also able to provide in the
Yeah.
training. Yeah.
Yeah.
That's
So we
sound.
think of it as like a mirror. The way that I use my self-talk influences how I hear and how I speak to the young person that I'm working with. So if I'm, as a parent, very critical, or as a therapist even, if I'm critical and I think, um, I'm doing a terrible job here, they don't understand me, why aren't they listening to me? If I get all pulled into that, then I'm not able to actually step into the place of doing the best job that I want. But if I'm aware of it, I can make decisions about whether it's helpful or whether I could just put it aside.
Yeah. And it's having the skills, isn't it? That I think lots of people don't always have. So I think that's a really good example of something people can take away
Yeah,
themselves.
absolutely.
Awareness and
Absolutely.
yeah, thank you. Okay, just a couple more questions now come to mind, Louise, if that's all right. How are we doing
No
for time?
problems. We're fine.
All right, thank you. So I suppose quite a general question in how do you think attending the training will help people in their practice?
Well, there's two things that I want to think about. One is how it will help you is it will help you think about the evidence for good outcomes. So the evidence base, and how to use that evidence base in a framework that is holistic. So one of the things I'm most proud of in the work that we do is we're not just focusing on one part of a person. We're not just thinking about your thoughts and feelings, for example. We're also thinking about your relationships, your sense of yourself, the external context in which you're living and growing. And we're using that whole framework from all the way out, the physical environment, your social connections and relationships, your sense of self, your thoughts and feelings and responses. And we're thinking about that in the context of the evidence. So we give, that sounds like a lot, but we actually give people a really easy way to think about how do I take evidence-based processes and put it inside that. And that sounds like a whole lot of words. It's really practical and easy when you see it. We think about function and we think about process and we think about using the evidence in ways that are holistic.
Mhm. That brings me really nicely onto my other question, which is about the evidence base. So what is the evidence base for ACTS, the DNAV model with children? Broadly speaking, you don't need to be citing references, but broadly speaking, what's the message?
Well, I wish I could tell you we had as much evidence for young people as we have with adults, but that's never going to be the case. So we have some good randomized controlled trials. We have work showing that these processes actually change behavior. We have it in areas such as anxiety, depression. But do we have the evidence like we have for adults? Of course not. We have thousands of studies for adults and dozens of studies for children and young people.
Same with many models.
Everyone would know that's the way it unfolds. Sadly, I wish it weren't true. But there is some evidence that's really good. For example, I mentioned the curriculum, the school-wide curriculum that was developed by my colleagues in the UK using our work. They developed a curriculum of 500 lessons that starts in 4 years of age and goes up to 12 years of age. And they've just finished a couple of randomized controlled trials showing good outcomes.
Mm-hmm.
And so there's more and more evidence coming all the time.
Great. And are these RCTs comparing to like no treatment, or are they comparing to an CBT or another model?
Well, we have all sorts. We have comparing to treatment as usual, like your standard child and adolescent mental health service treatment. Or we
Yes.
have comparing to no treatment, and some of them are waitlist.
And some of them are waitlist. Yeah, great. In all of those studies, it's shown to be an effective way of making change with young people.
Well, not all of them, but most the ones that are published. Well, you know, we have that problem of the ones that are not effective often don't get published. And I don't know of them, but I'm sure that they're around. Like it's as you
Yeah,
say.
just like any other model. But yeah, there's enough there to mean that we can practice it with our heads held high is the point really, is that this is a
Oh,
very
absolutely.
established model with a lot of research behind it.
Yeah, absolutely. Absolutely.
Great. Another question came in there, Louise, so I will come back to it. While I'm thinking of it, is there anything else that we haven't covered that you think might be nice to mention?
Can't think of it, Marie. I can't think of anything.
We've covered the basics, haven't we? We've said what the model is, we've said what the training is, who does it apply to, what the evidence base is.
I've
Oh,
been
what
very
I'm
thorough.
okay, great. I thought of what I was going to say, and it's just to highlight a point, really. Um, so, Louise, as I sit here listening to you, in awe of you and your research and your clinical background and how you have developed a model that's been shown to be effective with young people. What this means is that people have what I would say is a really rare or unique opportunity to learn a model from the person who created it. So would you say that that's a fair summary? You might have said it a bit differently, but in
Well, I think it's a fair summary, Marie, although I'm a fairly humble kind of
I
person.
know
Um,
that.
and so we'll just say you get to learn a model from, how about we put it like this? You'll get to learn about therapy and counseling and supporting young people from someone who works with young people.
All
Not from
right.
someone who reads the books, but from someone who has
Yes.
worked to try to work out the best way to do it, and
Uh-huh.
along the way develop some great resources that people use.
Well, that's a much more humble way of putting it. But, for the viewer, she did invent the model and we'll be training people in the region in the model directly, which I think is pretty cool. So thank you.
Thank
Thank you very much, Louise.
And I'm
Oh,
super delighted to come to Dubai and to do the training. It's like to hang out in a room with people who are all trying to serve young people and trying to help the lives of young people. Like that is a really cool thing to do. And
uh-huh,
so I think I count myself as fortunate to have that opportunity. And I think it's a great place to work for all of
uh-huh.
us.